Hello. Um, my name is Giselle. Um, and this is my presentation on what the topic we selected and the agency and their findings. Um, so the field of social work that we chose was hospital social work. Um, and that was primarily with children, so pediatric hospital, social work. Um, the setting was in a pediatric hospital clinic. And the focus was supporting children and families during medical care. So the research that we did was we had two articles that we reviewed, and one of the articles focused on um, how families and social workers work together in inpatient or family meetings for pediatric infants. And then the other one was how to support families with basically talk therapy. And the research emphasized that emotional support, communication, and advocacy are important in primarily in all social work, but in hospital social work, it's very necessary. Evidence-based practice is important in hospital settings. So the agency that we chose was Shriners Children's Hospital. So they are a specialty hospital. They focus on orthopedic and rare medical conditions or needs of children. And the cool thing about them is that they provide care regardless of the family's ability to pay. So they'll just do it um without the family having to pay at that time. Okay, so their mission is to provide specialized medical care to children and support the whole family and not just their medical issues, which is where social workers come in. Um, so the clients are the children with severe injuries, disabilities, or medical conditions. Clients are families from different states and even different countries. The social worker we talked to was mentioning that there were families that were coming from Latin America just to get treatment here. And many families that experience financial and emotional stress. Those are the people who are usually there at Shriners Hospital, which is a good which is good that there's social workers there to help them. So the social worker's role in this particular in hospital social work is to provide the family with emotional support and also the child that is going through I guess a hard time with either a new diagnosis or just something that's not expected. They assess mental health needs as well, help with resources like housing, food, and transportation that doctors wouldn't necessarily think about when talking to patients. Support families during difficult medical decisions, and advocate for the child's needs. So, our interview questions, um, we had interview questions and we've had a really good talk. It was very productive, and she gave us a lot of information, which I think really helped our understanding in in social work, especially in hospital setting. So, one of the questions we asked was how Is she able to process her emotions or sort of keep her emotions on under wraps when she's going through something that's a bit emotional? And her answer was that she didn't really have emotions because of the training that she went through, and sort of also having this self-awareness of their triggers and how they're feeling at the time, and if anything's happening in their body or if their voice is changing, having that awareness is good. There should be boundaries between work and personal life, not bringing your work home. The thing that she said was right when she walks out of the hospital doors, she leaves everything there, which I think is really important because we go, especially with hospital social workers, they're going through a lot of emotional things, especially with little kids. Not many people like working with little kids just because it's harder to keep your emotions under wraps. And yeah, I bet the emotional burden for many social workers dealing with the kids or any population is pretty hard. So having that work and personal life balance is a good idea. Active listening, when the families are upset. I think this is really important. Acknowledging that the family is struggling and they are having a hard time, even when they're mad. I can understand why most parents would be mad or upset when they find out this, like their new prognosis. It's very scary. So empathizing and understanding is really key for hospital social workers. Social workers help family understand medical information. A lot of like the jargon, medical jargon, is very hard to understand. And so I think with social workers having, I get, with hospital social workers, I guess knowing a little bit of that jargon and understanding more of the medical field helps them, helps the family also understand what's going on, which I think is really key for the parents to understand what is going on. And and to also make the child's voice heard in these situations because usually they're not really taken into account even though there are the ones that are going through this. Most doctors or places go off of what the parent wants, and not really listening to what the kid wants because they're underage. So, and the parent has like more say. But I think with social workers advocating for the patient, even if they're little, I think that's very important to have the kid voice be heard. So, ethics and professional behavior. Um, I think clear boundaries with clients are required. You should never, I think even in a, especially in a hospital setting, there should be a level of professionalism there, and to never stray from that professionalism. I mean, I guess with like the little kids, there it's fine, but like just remembering to keep the professionalism there. Personal life is kept separate from work, as we discussed. It's very difficult to do that sometimes, but I think it's very important if you don't want to, I guess, burn out quickly. Limited self-disclosure is used only when helpful. Professional relationships are always maintained, and trauma-informed care guides ethical decisions. I think all of these points are very important. So salary and advancement, the starting salary, it depends. It varies by state, and hospital. I think I saw one that was like $25 an hour. Um, and it was full time. but I don't remember. But it really depends. Because I think in Utah, um, it's more on the low end. I don't remember. Um, but there's other states that pay them higher, or double the amount. And then there's higher pay with like a difference in degrees. So an MSW, so yeah, an MSW would probably be um paid more than a BSW, but then again, there's different circumstances, or maybe there's career growth. They give like maybe they give promotions. It really depends. And especially with the LCSW license, that could really that that's like that can really level up that pay raise. Um, there's also opportunities to move into leadership or specialty roles. I think in any field or in any social work field, there's um, different roles that you can play in. When with these, experience allows movement into private practice or supervision. Um, so yeah, having your own, you can have your own private practice, which I think makes more money. Right now, I think private practice is the way to go for most social workers. But yeah, I guess it really just depends on what area and where, what agency, and what type of social worker you are. So job satisfaction, I think that so. The job satisfaction is really good, I think, just because they're with kids and with families. So people that have like are really and like have really strong connections with their families or children, I think would really enjoy working there. They have meaning, they find meaning in what they do, and also enjoy helping people, and they find it like really rewarding at the end of the day, even though it can be like very emotionally challenging. Like I said, working with kids, especially sick kids, it's really difficult, and I couldn't imagine um what people that aren't usually um that aren't used to working with kids. I couldn't imagine how they would be able to um, be emotionally stable in those work environments. So, organizational structure, medical staff. So, in the hospital, there's doctors and nurses, social workers. They'll collaborate with them and also the rest of the care team, which could be like anesthesiologists, endocrinologists, other people like that. Social workers communicate between families and the providers, and then social work role is becoming more integrated. So, they are trying to get the social workers to be more involved into the care team and these family meetings. So hopefully there's more social workers. So the positives, um, like I said, helping the family and making a difference in these kids' lives, like finding resources that say they're homeless, like the parents are homeless, or they don't have food. There's Ronald McDonald, um, places that help them with that, and also clean clothing, housing, while the kid is in treatment, and also opportunity to use counseling and advocacy skills. So just using your skills can be a positive if you like using what you've learned, can be a positive in a hospital social work. So some challenges are the emotional. I think that's the most difficult thing that is with a hospital social work, especially pediatric. working with the kids and seeing them so like being so sick and weak, it can certainly affect you if you're not ready for that and you're not equipped for seeing those types of situations. There's sometimes limited resources. I know there's only so much Medicaid beds for mental health patients, only so many resources for patients. And it's hard when we can't find those resources for the patients, and it makes us feel, I guess, even more emotionally distressed when we can't find stuff for the patients. There is also a high workload. Many cases, um, and it really takes a toll on the social workers when they have to take on so much and they can't really keep control of all of those needs. And navigating just the medical system in general. We're social workers. We're not like doctors or nurses. So some of the jargon that we hear for the first time can be really confusing, like CT scan and blood transfusion, IVs, other different types of medications. We don't know what they're used for. So, it can be really challenging to even like work in a hospital setting because we could feel like what is going on? What are they talking about? And it's just very difficult. So, applicability for to social work, it shows importance of evidence-based practice, demonstrates advocacy and ethical decision making, highlights role of social workers in healthcare, and then connects theory to real world practice. So, in conclusion, I think our interview went really well. She was amazing. We had a really good discussion. She even talked about like potentially teaching at Slick, but she said no promises. And I think it was a really productive conversation, and we got real insight into what a hospital social worker actually does. It also reinforced my interest in working with kids, especially in a hospital setting. I've been in and out of the hospital ever since I can remember, whether it be for physical or mental health reasons. And just working with a bunch of social workers has really given me admiration for the field and also have given me some hope too. I also like that it showed both the rewards and the challenges in the field. I think if you can balance both of those pros and cons, I think you will really enjoy it. Um, and I think the work is just so rewarding. I think anything else um would probably be on the side, honestly, because just getting to see people be so happy and for what you do, and even having a little talk with the patients too, or the families, it can really help their whole day and can make them feel a little better. And yeah, it just confirms my desire to be a social worker. I am so excited to continue my future career as a social worker, and I hope that I can continue to learn and grow along with everyone else. Thank you.